While Governor Gavin Newsom proposed a positive fiscal outlook for the state budget in his Thursday presentation, some advocates are taking issue with the cuts the governor is making to balance the budget.
Yeah, it's the most expensive budget in state history, with some of the budget cuts, some of the biggest cuts to budget being the health care program. ABC 10's State Matters political reporter Jenny Ha is here now to explain.
This is Newsom's final budget as governor, and he says he's trying to leave the state in a stable fiscal state for his successor. But healthcare advocates do worry that some proposed cuts will hurt immigrant communities.
So we are balancing not just for the next fiscal year, which ends July of next year, but we're balancing for another year.
A near $350 billion budget proposal by Governor Newsom, the largest in California history. In updated numbers, Newsom says the state will no longer have a budget deficit in 2026 to 2027, as well as 2027 to 2028.
No big, new, ongoing investments. We can't afford to do that right now.
A mix of factors is behind the new fiscal outlook: higher than expected state income tax revenue, largely due to the AI boom and stock market gains, as well as revenue via additional taxes. But there are also multiple cuts on health care, especially to undocumented immigrants, a population Newsom has expanded Medi-Cal to.
It's pretty unconscionable.
The problem is that the cuts he's choosing to make end up just compounding the effects of the federal cuts because he's targeting the same populations.
There are some new investments, like $300 million for Covered California, the state's insurance marketplace, but also cuts largely due to the so-called Big Beautiful Bill. Newsom unveiling plans to raise Medi-Cal premiums for undocumented immigrants from the scheduled rise from $0 to $30 to $50 instead.
Life is not cheap in California. It's going to kick people off.
Newsom also proposing switching certain undocumented populations to fee-for-service health care, which could make accessing certain care more difficult.
So if we were to keep them in the managed care system, we would not receive the federal reimbursements, which would be a lot more money that the state would lose.
These cuts on top of reductions Newsom proposed in January, like work requirements and twice-a-year renewals for those utilizing just state, not federal dollars.
Not required for California to extend the new federal eligibility requirements to these state-funded populations, the way that he is essentially abandoning his legacy to really championing healthcare access for everyone.
Newsom's response?
We had to deal with reality, deal with the cards that are dealt. We have universal health care in this country, regardless of pre-existing condition, ability to pay, and regardless of immigration status. We have it. It's called the emergency room. And we're paying on the back end sick care. I believe in universal health care.
Both Senate and Assembly Democrats have pushed back on the governor's initial health care cut proposals from January. In response to Newsom's May revise, they both emphasized the need to safeguard health care, with the Senate saying the implementation of Medi-Cal premiums must be delayed. Jenny Ha, ABC 10.